This is Mr. Mehta. Unfortunately, he cannot recognize his sister, who has come all the way from Australia to meet him. This is because Mr. Mehta is suffering from Alzheimer's disease, a progressive disease of the brain characterized by impairment of memory, thinking, and behavior. Like Alzheimer's disease, there are many other diseases that affect the nervous system. As the nervous system is the main center of the human body that controls and coordinates all human activities, any damage to it can have severe consequences. Let's learn about some diseases that affect the nervous system. Alzheimer's disease is commonly seen in people above 60 years of age. It is a disease caused either by genetic factors or by the destruction of the neurons present in the brain, leading to irregular functioning of the cerebral cortex. Some symptoms of this disease are confusion, language difficulties, mood swings, and problems with attention, along with personality changes. These symptoms generally develop slowly and get worse with the passage of time, becoming severe enough to interfere with the patient's day-to-day tasks. Another disease of the nervous system generally seen in people above 60 years of age is Parkinson's disease. It is a slow progressive disorder that affects movement, muscle control, and balance. Fortunately, it is not a hereditary disease. Parkinson's arises when certain nerve cells in the brain stem are destroyed, particularly the crescent-shaped cell mass known as the substantia nigra. These cells are responsible for the release of essential neurotransmitters like dopamine that are required for control, movement, and coordination. The degeneration of these nerve cells causes involuntary contraction of certain muscles, resulting in symptoms such as loss of the ability to speak or write clearly, tremor in the hands, and lack of coordination of muscular activities. Another nervous disorder is stroke, which can occur at any age. Stroke occurs when the blood supply to a part of the brain is disrupted, either due to cerebral thrombosis or intracerebral hemorrhage. Some symptoms of stroke include weakness or numbness of the face, arm, hand or leg on one side of the body, inability to speak, inability to write, and double vision. In cerebral thrombosis, there is a blockage in the artery supplying blood to a particular part of the brain, resulting in a stroke. These blockages are due to blood clots, commonly seen in arteries that get hardened due to a buildup of cholesterol and other fatty deposits. This can be avoided by eating a balanced diet with controlled quantities of cholesterol and fat, coupled with exercises. Intracerebral hemorrhage is bleeding within the brain when a diseased blood vessel breaks, the most common cause for which is high blood pressure. A stroke can result in loss of speech, loss of vision, and can even cause paralysis. Meningitis is another disease that affects the nervous system. In this disease, There is an inflammation of the protective membranes that cover the spinal cord and the brain, known together as the meninges. The inflammation can be caused due to infections from virus, fungus, bacteria, or other parasites. Some common symptoms of this disease are stiffness of the neck, headache, fever, vomiting, and confusion. The disease can be diagnosed by testing cerebrospinal fluid or the CSF test. There are different ways to get a sample of CSF, but a lumbar puncture is the most common method. A lumbar puncture involves inserting a needle into the spinal canal and extracting the cerebrospinal fluid, which is then examined to check if the patient has meningitis or not. Another disease that affects the brain is rabies or hydrophobia. It is a viral disease caused by the rabies virus and results in acute inflammation of the brain. The disease is transmitted most commonly by a bite from an infected animal, especially a dog. The rabies virus travels to the brain through the peripheral nerves of the spinal cord. The symptoms of rabies usually begin to appear 4 to 8 weeks after infection. The symptoms include uneasiness, headache, fever, depression, uncontrolled excitement, and encephalitis or inflammation of the brain. The victim is also unable to drink water as the lower jaw gets paralyzed. Moreover, the victim experiences painful and involuntary muscle contraction of the throat and chest, resulting in a morbid fear of water, which is called hydrophobia. Yet another disorder that affects the central nervous system is epilepsy. It occurs due to the discharge of disordered and abnormal electrical impulses from the cerebral cortex and is characterized by recurrent, unprovoked seizures. Some symptoms of this disorder include anxiety, restlessness, visual disturbances, and unusual sounds or odor. One of the tests available to diagnose epilepsy is an electroencephalogram or EEG. It measures and records the electrical activity of the neurons in the brain and checks for any abnormal activity. An EEG also helps identify any other abnormalities in the brain, such as brain death, coma, or the presence of a brain tumor. Like EEG, there are other modern devices such as CT scan or computerized tomographic scan and MRI scan or magnetic resonance imaging scan, which are also used to diagnose certain diseases affecting the nervous system. Some other diseases that affect the nervous system include poliomyelitis and leprosy. Poliomyelitis or polio is an acute viral infectious disease that mainly affects young children. The virus is transmitted through contaminated water, food, feces, urine, and through nasal secretion. It multiplies in the intestine, from where it may travel to the spinal cord, causing inflammation, and to the gray matter and destroying the motor nerve cells. Some of the initial symptoms of this disease are fatigue, headache, fever, pain in the limbs, stiffness in the neck, and vomiting. In a small population of affected people, polio can even cause permanent paralysis. Unlike polio, leprosy is caused by a bacterium, Mycobacterium leprae, and it damages the peripheral nervous system and the skin. The disease develops very slowly and causes skin lesions and deformities, which are usually very disfiguring. Some symptoms of this disease are skin lesions, muscle weakness, and numbness in the hands and arms or feet and legs. Apart from diseases of the nervous system, there are several other diseases that affect human beings. In fact, any disease that affects the body causes restlessness. In the same way, certain conditions of the mind affect the body. In other words, mental health and physical health are complementary to each other. The factors that influence mental and physical health include hereditary, disorders of the nervous system, childhood experiences, alcoholism, drug addiction, and family atmosphere. Therefore, it is important to take utmost care of your health, especially the nervous system, as it plays a vital role in the control and coordination of various life activities.